Big changes are in store for Medicaid, the joint federal and state program that helps cover medical costs for people with limited income and resources.
Well, however, the big, beautiful bill that was recently signed into law by President Donald Trump could impact the lives of so many Americans living with disabilities. Tonight, our Erie News Now Washington, D.C. correspondent Brendan Scanlon is joining us live. Brendan, you talked with advocates, and you have more this evening on what they are saying. What did you find out?
Hey there, Mike and Eva. Good evening. That's right. It was branded as the big, beautiful bill, but advocates living with disabilities tell me it could be catastrophic for the services they rely on.
The passage of this bill is concerning. It's scary to the disability community.
Shauna Eakin leads Voices for Independence in Erie, Pennsylvania, an organization that helps people with disabilities live independently. She relies on those same home care services herself.
But without my home care worker, I couldn't do my job. She comes in every morning, gets me up, gets me dressed, gets me ready for my work day.
But close to $1 trillion in federal Medicaid cuts, including a new requirement for states to pay more of the bill, could impact home and community-based services.
When states have to bear a bigger share of that cost, that means there's going to be fewer services.
The federal matching funds that come to Pennsylvania will be reduced. By what percentage, we don't know.
The vital services could be on the chopping block as states like Eakin's try to do more with less.
And those hard choices are going to involve looking at what they can afford to pay for and what they can't.
She says in Pennsylvania, home and community-based services are considered optional, unlike nursing home care, the only long-term service and support Medicaid is required to cover.
It's less costly to be at home. You can serve on average 3 people for the cost of 1 nursing home bed.
In order for the benefits to stay stable, we've got to eliminate the waste, fraud, and abuse. Benefits will be consistent. The way we operate, our overall operation, has been slimmed down and become more efficient, more effective.
Eakin says it's not a partisan issue, it's personal.
We're talking about real people with real lives. If everything happens the way that we think it will, it's going to be catastrophic.
Mike and Eva, many of these changes are slated to take effect at the end of next year. However, some of those changes might vary from state to state, so it's going to depend on where you're located. There's obviously a lot of uncertainty among advocates I spoke with. They tell me that they're going to be watching state lawmakers very closely to watch how decision makers at the state level handle those funding decisions with less money coming from the federal government. Reporting live on Capitol Hill for Erie News Now, I'm Brendan Scanlon. Mike, Eva, back to you.